started accepted our first cohort in 2014. So we just accepted our 7th cohort this past January, and we accept 20 every year. We have a great graduation rate. We have a 100% pass rate on our certification exams. So just in the short time that we've been here, our program has been very successful in that. And so we are definitely meeting a need. Occupational therapists in this area are hard to come by, and so it's been really neat to see our students when they graduate. They have jobs almost immediately, which is really nice in a time like this, that they don't have to worry about, will I have a job or whatever. So that's kind of a need that we have in this community, and a need the NSU OT program has been able to meet. So this opportunity for students, they've been kind of forced to use it in the last couple of weeks, but I think it's been really good for them. They are even getting together in small groups on their own, and meeting together in small groups to complete group projects. And so they're learning, how do I communicate via a virtual setting versus in person? And then they're going to be able to translate that to, okay, how can I do therapy with a client through a virtual setting, which a lot of therapists are using right now because of the quarantine. And I foresee that it's going to be something that continues to grow and move forward even after the quarantine is over. So I see the benefits as twofold. They're able to use it as class for academics and to get their assignments done, but they're also learning skills that are going to that they're going to be able to use once they graduate from the program. We pride ourselves in our program of doing a lot of experiential, hands-on, outside of the four walls learning, which is really great when you're able to be on campus and go do field trips and stuff like that. And so we really had to shift a lot of things once we found out, okay, we're not going to be able to visit these hospitals for field trips. We're not going to be able to bring people in. So we've had to do some things like, I usually have a panel at the end of the spring semester, a panel of guests that have various conditions that we talk about throughout the semester, like cancer and spinal cord injuries and traumatic brain injuries. And so we talk about those things all semester. And then every year at the end of the spring semester, I have a panel that comes in, and each guest on the panel has one of the conditions that we've discussed. Well, obviously that we weren't able to do that, but we're going to be using Zoom. And so they're going to Zoom in with us just one-on-one and allow our students to do question and answer with them. So all of these things we really have been able to use distance, virtual, different software that we already had in place to supplement a lot of the things that we had originally planned. We want to graduate students that are leaders. We want to graduate students that have set a standard for professional behavior in the field. We're learning that knowledge is one of those things that, yeah, they get a good foundation for it when they're in the program, but we want to have students that are willing to have lifelong learning, and that's what we call it.